I'm Fred Ling. I direct the Cardiac Catheterization Laboratory at the University of Rochester Medical Center. I got into medicine because my father was a physician, and he was one of the first Asian doctors in New York City. It was tough for a Chinese person at that time. He was born in 1915. To really get through the medical system, and it was through education that was the primary reason for his rise. He had to be at his best. He was a captain in the medical corps in World War II. He was in North Africa, he was in Burma, he was in Anzio Beachhead, and throughout all these things, he would tell us stories. And it's always the stories that inspired us, because through his adversity, he also found inspiration. You try to emulate your mentors and your peers. And ultimately, what was most important for me is to create a team that also felt the same way. I think that we have such a diverse group of very talented people that we work with every day, a group of individuals who have expertise in all their areas, whether it's from cardiac surgery, whether it's from heart failure, whether it's from anesthesiology. We all work together as a team, and when we see patients in our clinic, it really is as a team, and I like to think of it almost like you get an extended family. Patient comes in, they're scared, they're often with family members, they don't know what the condition's all about. Now you have this extended family where all of a sudden there's all this expertise that can explain in layman's terms what it's all about and the options. We want to make you live longer and feel better. And if we can do both of those things, we've accomplished our job.